I strongly believe that we aren't looking at deleting jobs. We're looking at making people more effective, and then we're going to have to get smart and shift the types of jobs that are available. But one of the things I feel pretty strongly about is our ability as a society to think critically about the information that we are seeing wherever it may be, and being able to take in that information, digest it, think critically about it, understand it, and then be able to take action on it. And so because of that, yes, AI will replace some jobs. That's inevitable. But I think what we're going to see is the creation of new types of jobs that people are going to need to fill.
Work is changing quickly, irreversibly, and often invisibly. I'm Chris Fanchi, and this show is about understanding where it's headed and how we stay human in the process. Hello and welcome to Human Work After AI, the show where we explore the future of work, technology, and what it means to stay human in the age of AI. We're speaking with founders, technologists, and thinkers who are navigating the shift toward an AI-powered economy. Today's guest is Connor Norwood, founder and CEO of Delineate LLC, a data strategy and analytics firm helping organizations transform complex information into actionable insights. With a unique background spanning academia, state government, and now the private sector, Connor has led initiatives from multi-agency COVID-19 data coordination to applying analytics for better healthcare and social outcomes. Connor, welcome to the show.
Thanks for having me, Chris. Happy to be here.
So I always like to start with my guest's background or their origin story, if you will. You've gone from academia to state government to founding Delineate. Can you walk us through that journey and what first got you into technology and on this path?
Sure. I never thought I'd be sitting where I'm sitting, but I've always kind of taken the path of least resistance. A mentor of mine once gave me that piece of information, and I've continued to follow that. And I thought I'd be a physician ever since I was like in college and doing all that. It was pre-med, and was just going to go the healthcare route. In that process, I encountered a bunch of different mentors throughout my time, and ended up doing my master's in healthcare administration, where some individuals convinced me that maybe a research route and going the academic path that way to be able to help a greater number of individuals through applied research in health and human services and health services research would be something to consider. And I ended up doing that, really focusing on health policy and health workforce research, focusing on scope of practice policy and legislation, and how that impacts the providers available to serve the vulnerable populations in Indiana and across the country. Then ended up kind of veering off that path through, once again, some additional connections who were working in government. And they enticed me to come run data for Indiana's Health and Human Service Agency, which is Family Social Services Administration. The typical Health and Human Service Agency would have, Medicaid, food stamps, cash assistance, mental health, aging, child services, Department of Public Health. Public health and child services in Indiana are separate agencies, but everything else is kind of encompassed into the FSSA umbrella. And then towards the end of my time as the chief data officer there, really focusing on improving outcomes for the constituents through analytics and research, on top of just the reporting that we are required to do as state agencies. Really focusing on governance and how do we really use the power of data to improve outcomes for Hoosiers in Indiana. Towards the end of that time, was asked to help to lead the multi-agency data response on COVID-19, working across the National Guard, the Department of Health, Homeland Security, and any other agencies that were directly involved serving the governor's office through that time. So that was kind of my journey on how I ended up as a state employee and working in government. And then towards the end of that, decided that maybe I can continue to help a larger number of organizations through consulting, and started Delineate in March of 2022.
So tell me a little bit more about Delineate. What do you guys do exactly? And how did you end up getting from health policy and management to a company like Delineate?
Yeah, so it's interesting. It's an interesting journey, and like I said, I never thought I'd end up running a small consulting firm. Never thought I'd be a state employee. I don't regret any of the path. I've enjoyed every moment of it. But throughout the pandemic, what I realized was I was spending a lot of time with state officials in the governor's office, other executives or legislators, local county officials, explaining data and doing the storytelling of data in ways that resonated with them. And I got that feedback a lot, that the way in which I was communicating what this data means and the implications for the decisions that they have to make today with that information really resonated with them, and it was easy for them to understand. I don't know if it gave me the epiphany that there was a gap there, but because everyone was talking about effective storytelling and informed policy making and this type of stuff. But I kept getting the feedback that the way in which I was approaching that was really resonating with them. And so I kind of continued on this path of, is there a way that I can go support additional organizations, whether it be the National Guard or other public health departments, local health departments, or private sector work, which we do some as well, and really understanding how this data, the analysis of this data, the outcomes of this data, and the insights generated from it, how do we translate that into the actual action or task or decision or thing that has to be made. And too often I felt like data insights are created, but then not really applied in the decision making process. So, really focused on how do I translate data into a way that these individuals can use the information to take some sort of action and do their programs or whatever it is differently than they do today to achieve better outcomes.
So, how did you come across this skill of data storytelling? Like, how did you discover that this was something that you were good at? Is this something that you had been practicing at? It was storytelling always a strength of yours?
No, well, I don't. That's a good question. I don't know. Like, storytelling has been a part of our cultures for eons. It's how we've communicated stories and information and history throughout time, right? So data storytelling is no different. It just applies, visuals and data and narrative all together to be effective in moving people to take some sort of action or remembering some type of thing. So I really think it was during my PhD program where a PhD program by its nature is designed to create researchers who are geared towards diving into and getting to the bottom of a very specific question and looking under every rock and every nook and cranny to understand everything about this one topic, whatever that topic is, or whatever that thing is that needs to be solved for. Looking back on it now, I think what allowed me to be effective in communicating data to executives was the ability to really narrow down what the very specific question is or the very specific thing that needs to be understood, and then ignoring everything else and really focusing on just that piece. I think one time I said to a business intelligence developer that we were going to delete 90% of the work that they just did, and the reaction I got, they were kind of shocked, and I followed that up with, "It's all great work. Everything that you've done and everything that you're showing is amazing. It's awesome. It's great. The problem is 90% of it is not relevant to this very specific thing that our audience wants to know. And so we're just going to park that other stuff over here on the side to not cloud the story or the message that we want to tell in this specific meeting to this specific audience." And that's very hard for people to do. It's very hard for developers and data people to feel like that's not lost work, right? And you didn't waste all the time. We had to do all those other side analyses and create all those other visuals so that we could figure out what the best puzzle was to put together to tell the best story to get these individuals, whoever the audience is, to feel confident in understanding the information so they can be confident in making the decision that they need to make.
Right. No, I don't recall who exactly said it, but there's this idea that your no piece of art or is complete until not that there's nothing more to add, but there's nothing left to take away, right? It's so
Yeah.
important to pull out the extraneous, and
Yeah.
especially when you're trying to portray a message or a narrative.
There's another book out there, but the author is Nancy Duarte. It's called Resonate or Resonance, and it's a great book. And she is a masterful storyteller. But one of the things that she says, and when I talk to people about data storytelling, I always bring up this quote. I'm not going to get it quite right, but it's something to the effect of, "It's not the audience's job to tune to our message. It's our job as the storyteller to tune our message to the audience." And that's always kind of stuck with me, that if we don't get them to understand it the first time, we need to try a different tactic, a different message, a different metaphor, a different whatever it is, because it's our job to have them resonate with our message, not their job to understand what we're saying. So I think that's something that's always stuck in the back of my head too.
Yeah, no, that's exactly right. So, what kind of organizations or businesses are you working with now through Delineate, and how has your background in this storytelling capability informed the kinds of engagements that you do?
So we still do a lot of government work. I would say more than 50% of our work is still government, state or local. And with that work, we do a lot of strategic planning, management consulting, program management. But I think where we excel in that is really helping executives feel confident in the decisions that they're making by providing more context, insight, data. I don't want to say gives them a crutch, but it gives them, we want to make sure that they're confident in the things that they're doing and how they're running their programs and the outcomes they're trying to achieve. We also have moved into some private sector work, working with sports organizations and doing sports analytics, and helping on in that space. Well, also doing some AI based work in healthcare, which has been quite in a fascinating area to work in, partly because of the fact that healthcare is highly regulated, which adds a whole bunch of different layers. But yeah, we end up doing a lot of strategy work, a lot of road mapping, and then as we start getting into these AI conversations, like I just mentioned, and some of these healthcare firms, they naturally get into the conversation around governance and data governance, which we've always been talking about, but data governance and now AI governance. And sometimes I feel like people are trying to separate that, but a lot of the work and conversations that we're having now is in that, how do we govern artificial intelligence and AI products in our organization? How do we develop organizational policies around AI? Because it's so new to us, and organizations have one or two paths that they can take here. One is put their head in the sand and ignore it until they can't ignore it anymore, because it will become like they will have to address it at some point, or try to ride the wave with everybody else as we're all trying to figure it out because it's developing so quickly. And how do I start putting stuff in place for our organization to protect our employees, our constituents, our clients, ourselves, all of the things that we need to be thinking about so that we don't get ourselves into some sort of jam.
So, how are you seeing AI impacting healthcare? What kind of use cases are you finding with it right now?
So the number one use case in AI that I see is expert human augmentation. That has been, it's the easiest use case for people to understand, right? And especially in healthcare. So what's interesting about healthcare though is, because we jump to these are life and death matters, we end up uh, this has always been the case. There are things that we do in the finance industry that you could call advanced data analytics, data science stuff. You could call it AI, um, but we're not willing to do that in healthcare because of that
Mm.
argument around, we're talking life or death, and it's not necessarily everything that we're talking about with AI is life or death necessarily, but that's kind of been the fear, right?
Mm.
But yeah, expert human augmentation is one that I think has a lot of legs in any field. But my actual background in health services research is health workforce, and we have health workforce shortages all over the country, and this is not news. This has been the case for years. And how do we increase the numbers, specifically primary care physicians, dentists, psychiatrists, and mental health providers? And how do we increase the numbers that are able to provide care in rural areas or underserved areas? And if we look at behavioral health, for example, we only have X number of licensed psychiatrists, and a lot of them are not registered or don't care to Medicaid patients. So how do we have those individuals become more productive and be able to see more patients without creating additional risk, health risk or whatever? And so when you talk about expert human augmentation, there's a world which, if we would embrace it and we could govern it correctly and not necessarily increase the risk to patient care, when we're talking about the amount of information that AI can consume and I'll call it draft generation of treatment plans or context that can support psychologists, licensed clinical social workers, psychiatrists, whoever it is, but still having that human interaction and human component and human touch to it would help us be able to mitigate some of the impact that we're seeing and the poor outcomes related to the fact that we don't have enough providers per people. So that, I mean,
Right.
that's a very interesting use case specifically in healthcare. Once you start getting out into like real generative AI, that potentially would be fully automated. I think people start to get very, very scared, especially in the healthcare industry, because it's so new and not highly regulated at the moment.
How are the actual people on the ground receiving AI within healthcare? I can assume that maybe within the administration that they see the benefits and the value, but if you're a doctor, if you're a nurse, are you embracing it? Are you still skeptical of it, concerned that it's going to give you something incorrect at the exact wrong time, things like that?
I mean, I don't know if I have for like firsthand experience or anybody that any practicing clinicians that I've heard say anything to me. So I can't speak directly to that. But what I would say to that is we have this tendency to lump when we say AI, we like we use it as like this end all be all umbrella thing. And so I think there's room for us to start truly teasing out and distinguishing what we're talking about with AI, right? So if we're talking about, AI, pre-generative AI, and AI really is just taking a lot of information and rules and inputs and learning based on that. So you can teach a computer to play chess, right? And it can watch thousands of videos of chess games and it can learn how to play chess very well and it will do better than most people. Right. But when
Mm.
we start talking about generative AI, now we're saying, let's tell the computer to create a game like chess. We'll show them what chess is like, but we want it to do these other things and then let it come up with a new board game and that has these. So now it's going to generate something completely new. And then when you get into this agentic AI stuff, we start talking about fully automated processes from start to finish with essentially no human component to it. And these are all various different, and there's all kinds of subcategories within that, right? So when you start talking about healthcare, like I said, I don't know if I have firsthand knowledge of how they're feeling, but I think that this conversation of teasing out what type of AI we're talking about and the initial use cases that are supporting our workforce and allowing them to do their jobs more effectively to ultimately do what we all care about, which is improve the health outcomes of patients, then it will be well received. But
Mm.
I think the gray area in the middle of not truly understanding what AI is, what are all the categories of it, what can it do, what can't it do, I think having that conversation is needed to reduce any kind of fear and then have a starting point of how we can slowly integrate it into processes and build trust with AI to ultimately achieve that goal of better population health outcomes in the health industry.
So, from your experience and perspective, where are we at when it comes to AI governance and dealing with risk and putting in guardrails around AI from a governmental standpoint, regulatory standpoint? What are you seeing?
So we so over in Europe, you tend to see a whole lot more regulation, and in the United States, we see very little, which is a blessing and can be concerning all at the same time, right? Because by having fewer regulations, it allows it's like a free check to innovate, right? We can
Mm.
innovate as much as we possibly can. It can really create exponential innovation. The flip side to that is we could end up getting into situations where we have massive data breaches or we have massive whatever the thing is that is some poor or negative outcome towards people or towards companies or towards whatever it may be. And so I don't know how I necessarily feel about it. I love the fact that we can innovate and we have the ability to do so. I don't love the idea that I think we're all learning as a society, and that includes legislators. So as we start to figure out how to regulate I think we need to put a lot of, I was going to say manpower, but a lot of resources behind educating the population. That's everybody,
Mm.
legislators, regulators, government agencies, our teachers, our kids in school, because it is it is moving so fast and developing so fast that we have to start learning and understanding what actually it is doing, and how we can govern it effectively. There's also this whole thing around government regulations, which is going to be prohibitive for specifically AI adoption in the government space. To be an example, in Health and Human Services, if you're talking about, um, you know, integrated eligibility or eligibility for any type of program like Medicaid, for example, or food stamps, there are federal regulations and statutes that specifically, that I would call them, they will be considered outdated for the use of AI, because they will have certain specific language that says that an individual or a human, I don't know what the exact language is, but it would basically, a lawyer would probably interpret that as you can't have an auto decision made without a physical person reviewing XYZ things per the statute and actually hitting the approve button. And it must
Mm.
be a state employee, like, right? So we've even ran into that in the past where, like, it can't be a contractor of the state. It has to be a state employee that is making the final determination on an application. So you run into these like federal rules that will have to be re-examined and updated at some point to either allow for or restrict the use of AI for certain processes in government. So
Do you believe we're moving in the right direction in your interactions with the government? Do you feel like this is being prioritized at a high enough level given the speed that the technology is developing and being adopted?
yeah, so I think that the fear that, I don't know if this would be articulated by anybody specifically, but I think the fear, some of these systems and the data and technology that make the world go round in the government space are very large legacy systems that have been in place for quite some time. And a lot of it comes back down to budget and expense. And it is very costly and expensive to update and modernize these systems. So I think there's fear. And anytime you do that, there's a lot of risk, right? If you're moving to a
Mm.
new system and modernize a system, you run the risk of business interruptions, minor or major. Business continuity becomes like a big question mark, right? And so I think the fear of major business continuity issues gives some level of cover for, I don't want to say for government officials or government agencies to hide behind, but to kind of pause. And this has always been the case. Let's let the private sector work out the kinks. Let's let the private companies do the R&D and figure out the legal and the governance issues, and then we'll be late to the party and jump on the bandwagon when some of that has been figured out and reduces the risk to us, because the investment, financial investment, and the resourcing and time commitment is substantial. So that doesn't really answer your question, but in summary, I think what I'm saying is I don't know if I feel strongly about how fast they should be moving or not moving. It's just pointing out that it will move slower than most groups would prefer. And unfortunately, there are a lot of efficiencies, both in cost and time and resources. And ultimately, our goal as in government is to provide like government services efficiently to our constituents, and that efficiency is key. Like the efficiency piece is key. If we have people waiting 6-8 weeks to get on unemployment, and they're not receiving unemployment for 8 weeks because of administrative processes that could have been done way more efficiently with modern technology and AI, why wouldn't we do that? Or if they're waiting to get on Medicaid, or if they're waiting to get food stamps or cash assistance, those types of things, like why wouldn't we move faster? But then you have the financial resource question, and then you also have the risk question of business continuity.
Yeah, and that risk question, especially when it comes to elected officials, right, is it's you can't a lot of times they don't think in 5 or 10 years, they think 4 years or 2 years, whatever the election cycle. And if something breaks during their term, they risk losing their position. So their tolerance for risk is a bit lower than you might see in the private sector.
Yeah, and then like another unique thing is just the way that government's financed. This is kind of tangential, but it's the same. You have election cycles and all that, but you also have um, governments do not like so data and technology. The way that it's been moving is a lot more towards not these big capital expenditures, but towards license or subscription based models or consumption
Mm,
based models or that type of stuff, right?
yeah.
Which we all agree has its pros, but there's cons from the government perspective too. When you're talking about budgeting, and if you're on a 2 year or 1 year, states are different. But like if you're on a 2 year budget cycle, a lot of governments like to know that I'm just paying $5 million for a thing that is for a 4 year term, and I want to pay it up front, and I want to expend, like if we buy a building, we're gonna depreciate it all, expend it all now, because that's how the budgeting works. We don't want like that on the books for 10 years, or we don't want a reoccurring expense for $250,000 a year every year. So there's also financing and like those types of things, that the way in which the data and technology are modernizing, there's business operation or business model conversations that are also at play. I know that's not necessarily AI specific, but it's just pointing out the nuances when you're talking about government versus private sector and their ability to quickly adapt to new and emerging data and technology solutions.
So let's transition a little bit back towards your business and what you are doing. How are you leveraging AI to achieve your goals when comes to an engagement? How is AI internally being utilized?
So one of the ways that we are using AI is to expedite our ability to research and consume information faster, so we can get up that we can reduce the time it takes for us to do discovery and a client engagement. Whereas before, I was actually just watching a documentary last week, and it was just it was from the 90s. And they were having to go to physical libraries and like look up information about federal rules on could you on this. And so just thinking about that, and then you asking this question, and me going through my academic PhD and how many literature reviews I had done, and how long, well, at least for me, everything was digital at this point. But now with really good AI prompts, we can have a lot of that information consumed, digested, and pulled together quickly. This doesn't mean that we don't then have to take that information, digest it ourselves, understand it, comprehend it, and become smart on it. It just means the time that it takes for us to go filter through hundreds of articles or gray papers, white papers, or online resources, we can do in a fraction of the time, and weed out the things that are just, we're going down a rabbit hole. So that is one that is a big use case that helps us significantly, and reduces the time to actually start generating value for our client.
Sure. When you're talking to clients, how often does the conversation find its way into replacement of jobs as opposed to simply alleviating things or increasing efficiencies? Does the idea of actually removing roles or no longer needing certain roles come up?
Yeah, all the time, all the time. And I think but even when you heard my example about like expert human augmentation and behavioral health workforce, and helping to create treatment plans that then are reviewed and used by a psychiatrist, for example, I never said that what this would do is it would help replace psychiatrists. What it would do is it allowed them to see more patients and use their expertise to see more people, because we can't train enough psychiatrists to serve the population that we have. And we've been doing all kinds of things through incentive programs, tuition reimbursement programs, to try and increase the pipeline of trained psychiatrists. It's just not working to the extent anybody would like, and there's still a need. So like that example right there just shows that I strongly believe that we aren't looking at the deletion, like deleting jobs. We're looking at making people more effective. And then we're going to have to get smart and shift the types of jobs that are available. But one of the things I feel pretty strongly about is our ability as a society to think critically about the information that we are seeing wherever it may be, and being able to take in that information, digest it, think critically about it, understand it, and then be able to take action on it. And so because of that, I don't think yes, AI will replace some jobs. That's inevitable. But I think what we're going to see is the creation of new types of jobs that people are going to need to fill. And so how do we retool, reskill, retrain individuals to be able to support whatever those new emerging roles are, that are going to be necessary to keep riding this wave and and keep people employed. Um, I mean, that's how I feel about it. I think if I'm getting real, I started thinking it's very dangerous at this point in state in AI, in the AI journey, and in where we are in society, to overly rely on the ability for AI to replace anything. Uh,
Mm.
just because there are so many things that are still too immature: governance, legal compliance, the potential to consume information, think critically about it, add appropriate context to it, and then make the decision based on all of these different things, some of which AI can't necessarily do in a vacuum.
So, what have you heard in terms of conversations around legal liability based on what an AI tells somebody? I think in healthcare, this is obviously a huge thing, right? If an AI tells a doctor something that the doctor then tells to a patient and ends up in a negative outcome, who's responsible, the doctor, the AI, and where does liability stand? What have
That's
you
a
heard about that?
that's a great question. I think all I've heard is a bunch of different chatter. What's hard about this is if you truly start to break down how large language models are built, they're built on the consumption of a lot of information, right? That's feeding tons and tons of information, studying our language, and then using algorithms to determine what the most likely next word is in a sentence. And that's how it's like building what it is most likely, like that's how it's generating content, right? As more LLMs are created, the training behind them is more of a black box. It's unclear exactly what information it has consumed. And you start getting into all these IP questions about
Mm.
copyright and IP and all of that kind of stuff. And there isn't necessarily the end user who gets the output of some sort of AI solution. I'm going to answer your question with a question. do they do they know do they know that some of the information that they were just fed in a response is actually copyrighted and they don't have ownership of the information? No, they probably don't.
Mm.
So then is it like, is it their fault? This is why you start getting into this whole like regulation component of the input into LLMs and AI solutions is just as important as the output, because we don't know who owns what information necessarily. And then if you start creating recommendations from AI, is it, and then someone turns around and provides that recommendation to somebody else? Like, I don't, this is not something that has been litigated
Right.
necessarily. So I think this is going to start well, it already is in super gray area, but the way that our justice system works and is going to be reactive, right? So once there's a case or two, whether it's in healthcare or another industry, where some wrongdoing and damages are done and someone then sues, then we will see how it plays out, and some sort of precedent will be established, because I don't think anybody's going to, at least yet, has really made it clear that we're going to proactively try to set the boundaries on who's liable in what situations. So I mean, I don't really know the answer to the question, but I'm very curious to see how it plays out. And hopefully nothing terrible happens. And by that I mean loss of life or those types of things as a result of it. But I mean, we'll get there. Just take time.
Yeah. I mean, we'd love to see the government be proactive about it, but there's obviously a lot of powerful lobbying groups, but also just any kind of rules that are put in place are going to have unintended consequences. And those consequences could lead to stifling innovation or slowing down things while we're dealing with other companies that might be getting ahead, or even other countries that they're putting more resources in with fewer limitations or restrictions. And so yeah, there's a lot of variables that you have to
Oh
deal
yeah.
with in this. Yeah.
Yeah. And I don't pretend to be a lawyer. So I don't like, I would, it's going to be, but this goes back to tooling our training and tooling our population, is that even the legal field is going to need to spend time really becoming maybe not experts, but law firms are going to have to start, they're going to have to be prepared, because this is going to start getting into a bunch of unknowns that are going to have to be litigated.
Yeah. Yeah. And with basically every business out there using AI in some capacity, there's a lot of opportunity for possible litigation issues to come up.
And to that end, I mean, you have this situation where I kind of hinted at this earlier, like the organizations could put their head in the sand right now and just be like, we're not going to use AI. Our policy on AI is like, we don't use it because we don't know where to go with this, blah, blah, blah. We don't have any internal policy. So that's going to be our policy. The problem with that is every one of their employees is probably using AI. So if you say you can't use ChatGPT, okay, and you ban it from your company computer, they're probably still going to use it as a personal subscription on their phone. And if there's
Sure.
output from that then they put into an email or into a client document, and you didn't know it was AI generated, and then something comes back and you've now opened your company up to liability and you didn't even know about it. So putting your head in the sand and not coming up with organizational policies that address the use and the parameters around AI may put you at risk even more so than having a policy that allows the appropriate use of it. So, um, yeah, uncharted waters for sure.
Yeah. So I know it's almost impossible to project too far down the road, but if we were to look ahead a few years, how do you hope AI has changed the way public services are managed and delivered?
I think if we're talking about public service, we have a very large population across the country that needs support, whether it's temporary, whether it's long term disability, whether they need some sort of government assistance to get up and off their feet. And they rely on those services so they can get up and off their feet and then back into society. And what I've seen is that we have an overly complicated system for social services, and if we can use AI and modern technology to create a more efficient system that members can interact with the system more efficiently, get them connected to all of the things that they need to get up and off their feet and then become productive members of society. If we can do that faster and more efficient, like that, I would love to see us have better outcomes, healthier population, and families having a better experience with the public services as a result of us adopting AI and modern technology to the extent that it is able to do that and not create any adverse events or outcomes to the population.
Yeah, I think that's what we're all hoping for in one way or another. Connor, this has been a fantastic conversation. Thank you so much for coming on the show. For listeners who want to connect with you, learn more about Delineate's work, where should they find you?
Our website is delineateconsulting.com. We're also on LinkedIn. You can find us. It's just Delineate LLC, or my LinkedIn, Connor Norwood. And happy to have a conversation with anybody. So thanks for having me, Chris.
Thank you. And for everyone watching, if you enjoyed this, please be sure to share it, leave us a review, subscribe so that you can always hear the next episode. And as always, stay human. Thank you for listening to this episode of Human Work After AI. Be sure to subscribe on your favorite podcast provider so you never miss an episode, and we'll see you next time.